Hello, my name is Dr. John Taylor. I practice dentistry in Ladera Ranch, California. You know, many of my patients will come to me and say, Doc, why do I need to take as many x-rays? I really don't like all that radiation and I want to keep my expenses as low as possible. So here's my response. First of all, I use digital x-rays. That fact by itself reduces the amount of radiation by 1/4 of when we use dental film. Number two, my job as your dentist is to ask questions, to see your personal history, to find out what individual x-rays I would recommend for you. A person that comes in and they're 30 years old and they have no cavities, no history of any decay, no gum disease will require fewer x-rays than a person who comes in and they have 5 crowns, 3 root canals, and a history of gum disease. The second person has shown that they have more of a predilection to dental disease. So I need to be a little bit more thorough with that person based on their history. So now let's talk about the 3 patients that came in and they have no dental pain, but we're doing routine x-rays for them. Remember, they have 0 symptoms, 0 sensitivities. So the first person comes in and they've got this lesion on this tooth. Not a big deal, just a small filling, and that issue is fixed. Now, person number 2. It's been a little bit longer since they've been in to see the dentist, and it's created time that they can grow this very large dental lesion that now requires a root canal and a crown. Much more expense and possible discomfort with this person, but this is what we're left with. And then the last person comes in and they come in and we know they have some wisdom teeth, so we take a pano, but it also shows that they have a very large cyst in their jaw behind this wisdom tooth. Well, imagine this is hollow, so the bone is a lot weaker and the chances of them possibly fracturing their jaw are very much increased. So these patients came in asymptomatic, and yet because we took appropriate x-rays, we were able to find these issues before they became a much bigger problem. My name's Dr. John Taylor. I hope this helps.